Pain related to joint conditions. So, osteoarthritis, generally one of the most common disorder, or the most common disorder of the joints, that is related to the pathology of cartilages, of the articular cartilages, and that is primarily related to aging, but not only. And well, right. So the most common joint involved in chronic osteoarthritis is knee. So knee are very painful, may be very painful in these conditions. Among other mechanisms, peripheral and central sensitization contribute to pain perception in osteoarthritis. So one thing is how the cartilage is destroyed and how much for how big problems it may lead. And the other thing is the perception. Therefore, eliminating the inflammatory component of pain generator may still not completely resolve the pain syndrome. Central sensitization may explain why some patients may still complain of knee pain after a total knee arthroplasty. So central sensitization is when the pathways, when the way how the pain is processed in the central nervous system, like the spinal cord and brain, can be altered and can increase the pain. The management of arthritis differs significantly between rheumatoid arthritis or other inflammatory arthropathies and osteoarthritis. Early referral to specialist is recommended for any patient with rheumatoid arthritis or possible synovitis. Treatment of rheumatoid arthritis favors the use of a combination of disease-modifying anti-rheumatic drugs and analgesic treatment. Some patients respond rapidly to disease-modifying treatments, further supporting the practice of early referral to appropriate specialists. Non-pharmacological approaches. Yes, so about non-pharmacological approaches, the very important is the patient education and self-management. Generally, there is also proven that change in lifestyle, also reducing the mass of the body, exercises can lead to reduction in pain. Because exercises, for example, can help in stabilizing the structures of the joint. Initially, focus should be put on self-driven treatments rather than passive therapies in an effort to get patients more self-reliant and active in the treatment. As of course, the weight loss will reduce the stress put on the joints, so because we are mainly talking about the lower extremities, and may be very efficient way of reducing the signs and symptoms. Also, the comprehensive therapy should include the application of appropriate assistive devices like canes, walkers, when appropriate. Such walking aids reduce pain in patients with arthritis of weight-bearing joints like knee and hips. Provision of assistive devices should be accompanied with appropriate instruction. Yes, so it is not enough to have those devices, it is not enough to have correct devices for correct person, but also this person needs to know how to correctly use them. And generally, the guidelines recommend appropriate footwear for all patients with symptomatic hip or knee. Yes, so the footwear is also very important. In some patients with medial tibiofemoral compartment osteoarthritis, lateral wear insoles have shown some benefit. Yes, so when we have sometimes osteoarthritis of the knee may lead to pathology of the geometry of the joints, yes, some valgus or varus deformation, and this can be helped partially, at least, by appropriate change in the footwear. And generally, the footwear is very important in order to reduce the risk of exacerbating the signs and symptoms related to the knee. TENS was also found to be effective as exercise and better than placebo for controlling pain. So TENS is also very good.